Hi, I'm John Lentz. I'm a pediatric orthopedic surgeon at Seaview Orthopaedics. I specialize in all musculoskeletal conditions involving children, and today I'm going to be talking about one of those, which is scoliosis. So scoliosis is abnormal curvature of the spine. It's really a twisting of the spine that happens mostly for unknown reason. There's a few different types of scoliosis that we see, but the most common one is called idiopathic scoliosis, and that means we don't know why it happens. It's a young, healthy patient typically with no other issues than a mild curve or sometimes a significant curve in the spine. Typically, the adolescent form is one of our most common ones, and that's our 10 to 15, 16-year-olds that we see this in. And typically, they'll start screening around those times for the adolescent types of scoliosis. I believe that our pediatricians and school nurses do an excellent job of screening even our younger patients, and I commonly see even mild curves that are picked up by them, which is great because the sooner we can catch a scoliosis, the sooner we can start treatment and prevent it from getting worse. So now I want to show you my typical scoliosis exam that I do in the office routinely. This is our young patient here who volunteered for this exam. So the first thing we're going to do is we're going to take a look. If you can turn around, we're going to look at your back. Stand up nice and tall, look straight ahead. So the first thing we check usually is the shoulders. See maybe one shoulder slightly higher than the other, but he's relatively symmetric today. Shoulder blade, same thing. Relatively symmetric, maybe slightly elevated. Try to relax just nice and loose there, good. Then we feel the waist crease here. We can get an idea of if one side of the pelvis is higher than the other side. That can sometimes lead to a false scoliosis exam. And then we're gonna have you bend forward. I want you to let your arms fall in front of you and let your head fall down, bend forward at the waist. This is one of the biggest and most reliable tests for scoliosis. What we look at is the rotation of the chest wall and the lumbar spine musculature as well. The next part of our exam is the neurologic exam, and we're gonna first start with the muscle strength. So do me a favor and push your left knee up against my hand like that. Good, same thing with this one. Awesome, push both your feet out towards me. Push, pull back towards you. Good, toes up to the sky and toes to the floor. Push down, excellent. Had he had a positive test, as I brought his ankle up, we would see some fasciculations or up and down movement of his foot. So the next part of our neurologic exam includes measurement of the popliteal angles, which is simply a measure of how tight the hamstrings are. We want to see if there's any asymmetry. We measure the angle from a straight line and across, and we compare side to side, and see he's pretty symmetric there. If one side was very straight and the other one was bent, we would be concerned for possible neurologic cause of his scoliosis. The other thing we check while we have the patient laying down is the abdominal reflexes or the reflexes around the belly button. So we're just gonna roll his shirt up just slightly to expose his belly button, and we're gonna watch closely as we pull across in all four quadrants, and the belly button shifts towards our line each time, which is a good sign. So we always check the reflexes as well. We start with the Achilles reflexes. Good. And then the patella reflexes. Everyone's favorite. So the next step for a child who's had a positive screening either by their pediatrician or the school nurse or even a parent who noticed some asymmetry in the back would be to come see a pediatric orthopedic specialist. Typically, if we see a patient in the office for scoliosis screening and we do our own exam and believe there is a sign there might be scoliosis, we'll go ahead and get an x-ray in the office. That will allow us to actually measure the curve and see the magnitude of it and try to help guide possible treatment for it. So once we've decided to get the x-ray, we will actually look at the x-ray with you and review all the results. We'll go through the measurements and show you what your curve looks like if you happen to have a scoliosis curve, or sometimes we're giving you good news that there is no sign of actual scoliosis. Either way, we're going to help guide the next steps for you. The way that we treat scoliosis is only really a few things that we do. The most common thing we do is we just observe it. That might mean just coming in for physical examinations and possibly x-rays every 4 to 6 months, keeping an eye on you to make sure that the curve doesn't get worse. Another thing that we add in for our higher grade mild or maybe our moderate curves would be something called Schroth physical therapy. This is something we're really happy with the results of early on right now. We have Schroth physical therapists here at Seaview Orthopaedics where we're seeing excellent results in terms of sometimes even correcting some of the curve and other times helping prevent the progression of the curve. So this is something that is somewhat changing the management of scoliosis these days, becoming a lot more popular, and we're happy to have Schroth therapists here at our own practice. For our more moderate curves in a patient who's still growing, we typically recommend a brace. And the bracing protocol is really doctor dependent, but the goal of that brace is to prevent that curve from getting worse. We don't want a moderate curve going to severe. So anything we can do to prevent that is great. And the best results we have from all the scientific studies on this are to put a brace on, and potentially brace plus Schroth physical therapy together is really the best combination I think we have right now to to help prevent the curve getting worse. Some of these curves you can't control, but a lot of them we're able to hold off with those two methods. We reserve surgery for the severe curves, the ones that are really over 50 degrees. The reason for that is the long-term studies on what happens in the scoliosis over 50 degrees. Typically, we can expect progression even when growth is done in the severe curves. So curves that are over 45 or 50 degrees, on average, will progress about 1 to 1.5 degrees per year into adulthood, even when you're done growing. Whereas the moderate and mild curves will not progress when people are done growing. That's why we use those factors to determine what our treatment is. So one of the most important parts of my job, is usually how I close out my visits, is reassuring the patients that this is a normal thing that happens to some kids, and we don't know why it happens. It happens to young, healthy people. It shouldn't be restrictive in any way. It should still allow them to play sports or dance or do whatever they might want to do. We just want to make sure that we can address any issues as they come. So at Seaview Orthopaedics, we have a great scoliosis department that can assist patients through all of those levels, whether it's just physical therapy or observation to the physical therapy side or all the way up to the surgery side.